Welcome to Module 2. In this lesson, we'll learn what CPT is, why it was created, and why it's important in medical coding. CPT stands for Current Procedural Terminology. It is a standardized coding system used to report medical procedures and services performed by healthcare providers. Examples include office visits, blood tests, X-rays, and surgery. In simple terms, CPT tells us what service was performed. CPT was introduced by the American Medical Association, or AMA, in 1966. It was created to provide a standardized way to report medical procedures and services. CPT is updated annually to keep up with changes and advances in healthcare. CPT is important because it provides a consistent way to report medical procedures and services. Accurate CPT coding helps communicate what was performed, supports the claims process, and helps with appropriate reimbursement. That's why accurate documentation and coding are so important. CPT codes are used throughout the healthcare system. Providers document the services they perform. Medical coders assign the appropriate codes. Healthcare organizations submit claims, and payers use the information to process claims and reimbursement. Here's an important distinction. ICD-10-CM reports the patient's diagnosis, or why the patient received care. CPT reports the procedure or service, or what the provider did. These two coding systems work together to describe the patient's encounter. Let's look at how ICD-10-CM and CPT work together. A patient visits the doctor for chest pain. The doctor evaluates the patient, performs an ECG, and provides treatment. R07.9, chest pain, unspecified, tells us why the patient received care. CPT 93000 reports the ECG service and tells us what the provider did. Together, they tell the complete story of the patient's care. Let's test what you've learned. First, what does CPT report? Next, which coding system reports diagnoses? Choose your answer before we reveal the correct responses. The correct answer for the first question is procedures and services. For this second question, the correct answer is ICD-10-CM. Great job if you got both right. Let's review the key points. CPT reports procedures and services and was created by the AMA. It provides a consistent way to report healthcare services and is used in the billing and reimbursement process. Remember, ICD-10-CM explains why, while CPT explains what. Make sure to like and subscribe, and I will see you in Module 2, Lesson 2.